Hello, and welcome to another edition of Medical Minds Conversations with Guthrie Experts. Thanks again to the Cortland High School Modern Band Program for putting together that great rendition of Head, Shoulders, Knees, and Toes. Again, if you want to send us in your own version, just wait till the end of this podcast and we will tell you how. My name is Steve Osterhaus, and joining me as always is Dr. Corinne Johnston, who is a family medicine physician and Chief Patient Experience Officer for the Guthrie Clinics. Dr. Johnston, how are you? How was your weekend?
Good morning, Steve. I am doing well. My weekend was okay. We've had an unseasonably warm fall, but my kids still managed to bring home colds from school. So lots of blowing noses, sneezing, covering our mouths, and using Lysol all around. How about you? Did you have a good weekend?
I did actually. My daughter recently turned 13, so now have a teenage daughter. So she had kind of a little staycation sleepover out of the house with some of her friends.
Ooh,
But mom was involved in that, so I guess you could say I had a night off. So yeah, I had a good weekend.
great.
Last time we brought up some medical jargon of the day, so I figured I'd
Yeah.
bring up another one that we want to talk about, and that would be gustatory rhinitis. So I don't know if you want to tell us a little bit about what that's all about and what that means.
Yeah. Yeah, gustatory rhinitis. So break down the word gustatory surrounding food, and rhinitis is inflammation or running of the nose. So this is a really common thing we see, especially in primary care, in our patients as they age. They might have something spicy, warm, even just a hot coffee in the morning, and it causes their nose just to run. So common thing you'll hear from doctors, most are the easiest way to treat it oftentimes is picking up some over-the-counter Flonase or Nasonex. You can get that all now without a prescription and use that daily. And a lot of times that'll help so you're not having to use your hanky every time that you have something to eat.
So could the same be said for, we'll have spicy food and I'll be like, oh, it really cleared my sinuses with that one. Like I almost consider it a good thing when it happens to me, but you're saying that it can be more of a problem for some people?
Yeah, some people that can really trigger just almost like a faucet, they'll tell you, Steve. Like it just feels like the faucet turns on and they're trying to eat their food. Although I am one too that when I have a good horseradish, you really can feel that sinus explode. And I think a lot of us strangely enjoy that.
Yeah. And you said that happens, happens to more of us as we age, right?
Yeah, we do see it to be more common as we age. And I think that hits right on our guest for today and our topic for today, which is something else we see commonly as we age, but stroke.
Right. So, and I think people, when they think of stroke, there's lots of misconceptions, and I think stroke and heart attack seem like they go hand in hand, but they're obviously two different things. But I think, we're going to get into a lot of the specifics with our guest, but I think some of
Mhm.
the important things to point out are those symptoms. So, in case you're with loved ones,
Yeah.
during the holidays, what to look out for, if somebody is perhaps having a stroke.
Yeah. So we know that the quicker we can treat you, the better the outcome, much like a heart attack. Stroke is the same way. So the campaign that's out now is called Be Fast. And that's an expansion. It used to be fast. If you're listening and you say, no, 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 it's fast. They expanded that. It's been a while. It was pre-COVID to try to catch more people with more symptoms. And the idea behind that is if that occurs, you get yourself to the emergency room. Do you know what some of that stands for, Steve, that mnemonic, be fast?
I do. I can at least get the first one, and maybe
Uh-huh.
I've cheated a little bit because I do work in the medical field. But, but the B stands for balance, right? So,
Yeah.
onset of dizziness, loss of balance, things like that to watch out for, right?
Yeah, exactly. That's the B. And the E is eyes. So vision changes, trouble focusing. And then I think people are likely more familiar with the fast piece. So
Right.
face.
And right, face. That's the one that
Mhm.
that jumps to mind. So that's the facial drooping, usually on
Yeah.
one side over the other, right?
Yeah, usually one-sided, and I think that's probably one of the most common reasons people do go to the ER, is they see the drooping of the face. Um, Coupled that with arms is the next. A is arms. So weakness or difficulty moving generally. Speech is another one I think we see people a lot. They have word finding difficulty or they have a real slurred speech.
Right. And
Yeah.
the T is for time, right? Because time is of
Yeah.
the essence. So you
Time.
got to call
Yep.
911 as fast as you can. You brought up a
Yeah.
great point. You were talking about, the F and the S are, when it comes to facial drooping and speech
Hmm.
are the common ones that really set off the alarm bells with people, um, which can be tough, right? Because if they're experiencing other things, dizziness, they
Yeah.
might just say, "Oh, I got up too fast," or, some of those things
Yeah.
that just people put off to the side and don't get help. But so time seconds matter, right, in terms of our overall
Yeah.
treatment.
Yeah, a lot of times we'll say in medicine, time is organ, so time is brain. Now, if this is dizziness that you've woke up with every morning for 30 years, that's not a stroke. But if this is something different that's not getting better, that's not responding, that's progressive, time is of the essence. And certainly if it's coupled with any of the other letters in the acronym we spoke about. Steve, with us today, we have an esteemed vascular surgeon with the Guthrie Clinic, Dr. Larry Sampson, who is likely even more well versed in stroke and some of what we were talking about earlier. Dr. Sampson, we just reviewed F.A.S.T and what that means and how time is brain, essentially, for our listeners. Anything you'd like to add on about that or editorialize?
I would just emphasize what you've already said, that time is brain. And if you have any stroke-like symptoms, you need to get to the emergency room as soon as possible. It's not something where you want to wait and see if you get better, or wait till the morning, or wait till the weekend's over. Brain, time is brain. Brain is time. So you need to get to the emergency room.
So even before we get to the point, Dr. Sampson, where you need to go to the emergency room, what are some of the risk factors? What are some of the factors that could lead people to end up in that kind of situation?
So the two major risk factors that we can all work on with our primary care doctors, our families, our communities are control of high blood pressure. And as you all know, even people who are already under treatment for hypertension, over a third have inadequate control. With today's medications, you can have a well-controlled blood pressure without major side effects. This typically is not something that you go one time to your primary care doctor to get fixed. You may need multiple visits, and you may need to go through several different medications to get the right medication for you. It is critical, not just for stroke risk reduction, but also prevention of other heart disease, including heart failure and other vascular disease. And so control of hypertension is critical. The second factor that we can easily not that's important to treat. I understand how difficult it is to quit smoking, but quitting smoking is critical for stroke risk reduction. Um, I come from a family where both my parents smoked. My brother
Yeah.
smoked at one time. One of my four kids has smoked. I smoked for a little bit. Um, and it's critical to stop. I get how hard it is to stop. I get that it frequently needs help from family, primary care doctor. Um,
Hmm.
but it is critical to quit smoking. The single
Yeah.
biggest thing you can do to improve your health is quitting smoking.
Yeah. I think oftentimes our patients think that smoking is bad for their lungs and they forget about the other things. And that might hit right in, Dr. Sampson. I didn't even think about this at the intro, but what is a vascular surgeon? What does that mean? We're talking about you in the context of stroke, but what is the vascular system for our listeners?
So, your vascular surgeon will take care of um, uh, all problems related to blood vessels outside the heart and outside the skull. And so all the blood vessels in your chest, your belly, your legs, arms, neck, we help to take care of those. We're not just, so we are a specialty that typically follows our patients. So we don't just see people that need surgery. We see people that have a disease that may lead to surgery. And we would follow those people on some regular basis, every 6 months, every year. We treat arteries, so that's aneurysms, atherosclerosis, so blockages, and we also treat venous disease, and we do some other things, including help provide access for people for dialysis, helping provide access for people for chemotherapy or other things.
That's well, I say a broad range. Obviously, that's incredible to learn, how involved, you are within so many parts of the body. If we take a look at surgical techniques when it comes to treating stroke, what are we talking about in that realm?
So the first treatment was carotid endarterectomy. So this is the removal of plaque in the carotid artery in the neck to reduce the risk of future stroke. That procedure's been around since the 1950s, and it's been perfected over time. So it is a treatment that's proven the test of time, and which we have very clear reasons to do it with very clear, good results. A more recent version involves placing a stent in the carotid artery. A stent is a metal mesh tube. They can be highly flexible that goes inside the blood vessel to open it up further and to prevent any plaque breaking off and going to the brain, causing a stroke. The newest advance with regards to that has been this technique called TCAR, TCAR, or transcarotid artery revascularization. To do that, a small incision is made in the neck, and then some tubes are temporarily placed that reverse flow in the carotid artery while the procedure is being done. What this does is make it so that any plaque that inadvertently breaks off goes downstream through a filter and then back in the blood, then goes back in the body through the femoral vein. So it is a way of protecting the patient from having a stroke during the procedure where the stent is placed. It's quite a ingenious and remarkable technique that was initially described and discovered by the same gentleman who did the first endovascular abdominal aortic aneurysm repairs. Really quite remarkable.
It's amazing to me how obviously modern medicine moves really, really fast. But even somebody of your expertise, is it surprising to you to see all of these new latest and greatest in terms of technology and the ability to do this for your patients?
Absolutely. Absolutely. So just those two, the TCAR was first described in the 1990s, and the endovascular abdominal aortic aneurysm repair was first described in 1989, and then FDA approved in 1999. So even that incredibly rapid approval process to go from 1 or 2 patients described to going to being the standard of care, very rapid. Even in my, I don't mean to get too philosophical, but so I was born in 1959. So in my lifetime, the successful treatments for cancer were developed. And those treatments went from being incredibly having um, their own risks and their own problems to being much more refined. The treatments in my lifetime, many of the treatments, all the treatments we consider successful for heart disease and vascular disease have really been developed. It is striking. It's a really, to contemplate that for me is a very brings me more optimism about the world, and makes me really appreciate some of the really positive things in our world.
Yeah. And it sounds like that ability to catch your patients, you said you follow them before
Yep.
they have a stroke even.
Very important. Absolutely very important.
Yeah.
And but even blood pressure meds, right? So even there's all this technological stuff, which is very racy and exciting and gets all the attention. But, when I first started, there were 2 or 3 potential medications for hypertension, and they each had more substantial side effects. And now we have multiple classes and multiple options so that you can really be treated for your hypertension without having substantial side effects. There's so many options now that you have to count on having several visits with your primary care doctor and really participating in managing that.
And you
Yeah.
talked about the multiple medications, and that's great too, right? Because a patient comes in and maybe years ago they'd be like, well, this isn't really working for me. And it's like, oh, well, this is kind of all we have available. But now, eventually, at least the hope is you're gonna find that right medication for the right person.
Oh yeah, no, it's a given, I think, truthfully, for hypertension. I cannot overemphasize that one, it's not like you walk in, you get the medication, and you never have to worry about your blood pressure again. But the trade-off is you can walk in, have high blood pressure, and yet know that you and your primary care doctor can get that high blood pressure under control with medication that has minimal or no side effects to you, that will prolong your life and dramatically reduce your risk of stroke, heart failure, heart attack, kidney failure, peripheral vascular disease.
Yeah. So if I'm a patient that maybe doesn't do those things, or I do, but I still end up, it's lunchtime and I notice I can't say my words and my husband says that my face is drooping. So I know that I'm supposed to go right to my ER. What happens there?
Yes.
And especially someone like me, you're at kind of the epicenter of Guthrie and I'm more on the periphery. So how do you help me there? What happens next?
So they would do a rapid exam to confirm the concern for stroke. They would do an initial CT scan of your head to determine that it's not a hemorrhagic stroke, that the stroke is not from bleeding into the brain. Um, uh, about 20%, even less now, closer to 15% of strokes are from that. But the other strokes, the other 80 to 85% are from ischemia or poor blood flow to the brain, or from a blockage or clot. And so after that CT scan of the head, they would determine that whether you're a candidate for either clot busting or clot dissolving medication, or for an acute intervention, depending on how profound the stroke is, your other comorbidities, and where you are. And most hospitals can provide the clot busting therapy. The acute neuro and interventional procedures are done by major medical centers. Um, We currently don't do the acute neurointerventional procedures here, but they too, time is a factor, and so the decision would have to be made from a more rural center, or even us, whether you get helicoptered to a place that does those. That how your symptoms evolve over that first 15 minutes or half an hour where you're getting that initial evaluation is critical, because if you're well on the way to resolving most of your symptoms, you would be most likely put in one track where it appears clear that you're going to resolve your symptoms, and where the emphasis is on what caused this in the first place and what long-term treatments for that you need. Whereas if it's a profound stroke where you can't speak at all, can't move one side of your body, you would want that most aggressive treatment of clot buster or a quick neurointerventional procedure where they try to retrieve the clot.
What does, we don't want to jump ahead too far, but what does recovery look like? And I know it's different depending on how severe the incident is, but what does recovery look like for, I hate to use the word, the average patient? Or maybe you could tell us a couple of different paths.
Yeah, so I think when those first symptoms hit you, you're obviously very anxious and concerned, worried they may progress, and you don't know. So one first thing is, the more you recover, the more likely you are to recover. And so that can give you a sense of optimism. I think the second factor I would emphasize would be that you really can have remarkable recovery over time. And so in someone who's had a substantial stroke, you may be able to regain significant recovery. So you've had your stroke, you've had whatever acute intervention is indicated, and then we're talking about that period after that. And so it is critical that you participate in rehab and physical therapy and occupational therapy. And it's critical, a secondary depression is common among people that have had any major medical illness, but specifically stroke. And you don't want that depression to affect your participation in your recovery. And so it's not just a matter of powering through that depression. You actually need that treated so you can have still participate and aggressively pursue improved outcomes. So I would be very, your healthcare providers will be attentive to that, but also as the patient and community and family members, you need to be attentive to that.
I think that's so great that you said that, Dr. Sampson. I think our patients, there's a battle sometimes to get them to go to rehab. I think people want to be able to go home and be in the comforts of their home. A lot of areas, those rehabs are skilled nursing facilities. So there's kind of that attachment. So just how important that is and how important mood is, right? It plays into that.
Yes.
And it affects our ability to do. I think those are just great points.
And you want to, I'd encourage everyone to ask for homework from their physical therapists and occupational therapists. So, we hear that say I only get an hour and a half of physical therapy a day. But I would encourage you and encourage family members to encourage you to ask for homework. So there are things you can be doing yourself or that your family can be doing with you during the time you're not getting physical therapy to improve.
It's a team effort, I guess, right? I guess it's
Absolutely.
easy on the outside looking in to be like, no, you just have to do this. You have to do this. But it's a lot easier said than done for the patient themselves. So yeah, everyone has to pitch in and be part of that process.
Absolutely. It can't just be the physical therapist, but it also can't just be the patient. The more family you have to encourage you, the better, or neighbor, or and anyone. I think we are a culture um, that emphasizes rugged individualism.
Yeah.
I think illness makes us acutely aware of how much we need others. And I think uh, I would just encourage people to realize that there are some things in this life you really need help for. Stroke recovery is one of them.
Yeah.
It brings to mind kind of like feeling isolated. And maybe I'm stretching a little bit too far on this, but in terms of individuals who aren't as close in proximity to medical facilities, can you talk at all about at least leading up to hopeful prevention of a stroke? The advent of telemedicine and how helpful that is for people to maybe work on symptoms and prevent something like this from happening.
Yeah, I think that's a really strong point that um, access is critical for our communities, our patients,
Mhm.
for all of us, and that we now have available to us um, these strategies like telemedicine, which can improve our patients' access to us. And so I think it's critical. Um, the uh, in addition to the telemedicine, which implies a video visit, much like what we're doing here in some ways, you can also communicate by in Guthrie healthcare facilities through Guthrie, through telephone calls. The critical thing really is us providing that access and then patients taking advantage of it. Not
Yeah.
just in not just rural areas, but even in big cities. I think
Mhm.
access is an issue, and it's not going to go away. Um, it's just not. It's
Yeah. And important, I think, right? So if I'm one of those, well, that's not me, right? 1 in 8 women have breast cancer. Well, that won't be me. I think a lot of us think that way. So when we think about I'm listening to this podcast at home and maybe I'm a smoker, maybe I'm in a race where we have a higher percentage of strokes. Maybe I know that I have blood pressure that's borderline. So do I jump on and schedule an appointment with you, Dr. Sampson, on eGuth or on virtually, or do I go to my primary? What kind of leads to evaluation to see if you're at risk? Once we know you have some of those risk factors for stroke, what's
so
next? Is it ultrasounds, CAT scans?
so the indication for getting an ultrasound of your carotid arteries is um, primarily symptoms, but also the carotid bruit, which is a sound that your physician or provider, nurse practitioner, physician's assistant, may hear by placing their stethoscope at your neck. Um, the If you don't have a critical narrowing there, then you don't necessarily have to see a vascular surgeon. Uh, I I really, from a larger perspective, I think the critical thing is for our communities is working with their primary care doctors and nurse practitioners and physician assistants to reduce risk factors for stroke and all of our health conditions.
Yeah.
That becomes more important over time. I, when there are lots of great reasons to see me or one of my colleagues in vascular surgery, um, but and we do play an important role at Guthrie and in our healthcare communities. But I can't emphasize enough the critical importance of our primary care um, providers and just how important that relationship is for our community's health and for each of the three of our health, truthfully. Um, the It's just critical it's to think that one could reach the age of 60 or 65 or even 45 and not visit a primary care doctor just doesn't make sense. It's just not rational. And if it's a point of pride, then that's a foolish point of pride. It is critical to see our primary care providers who will address our individual risk factors that you mentioned, Dr. Johnston, but also age specific risk factors. The reason for a 30 to 40-year-old seeing their primary care doctor is different than a 50 to 60-year-old. And I'm telling you your business, but you know that there's certain cancers, certain health conditions, certain things that are really age specific. And maybe at 22, you don't see your primary care doctor every 6 months or every year. Or maybe you just see them for 22-year-old things. But by the time you're 30, 40, 45, there's some critical things that need to be checked on a regular basis.
Oh, well, we always appreciate the plug in primary care. And I just want to hit on one thing that I think is so important that you said, and to bring it back to stroke. So I had a patient recently in her early 40s, very healthy, follows with me regularly, who was at lunch with her son and started having trouble with word finding and had a left-sided weakness of the arm. And so her son was very good, called 911, and it turns out she did have a stroke. Now, a different type,
Yep.
type that we see in a younger age, and was able to have a simple procedure with cardiology to have that so it won't happen again. So I think the importance of stroke can happen at any age, but is much more likely as we age.
Yeah, agree 100% with that. That story also illustrates the importance of family, right?
Hmm.
And so um, uh, it's great with regards to that. Um, Theoretically, it also illustrates the importance of our children being literate in health
Yeah.
and health care. And
Hmm.
so, we as a society, as a culture, it is critical that our children be well educated about basic healthcare things, when to go to
Yeah.
the ER. Ideally, your kids are trained in CPR and basic first aid. Um, I keep pushing that on my kids. I have a certain self-interest in that, obviously, but it's critical, and
Yeah.
it's great that your friend's son was so good, knew what to do.
I'm coming away with a bit of a shopping list. So I can't say as I've gone without ever seeing my physician, since I was in my 20s. I've seen them since then. However, I do not see them regularly enough. And so now I have to write myself a note to set up an appointment. I feel great, but like you both pointed out, you always want to make sure you keep feeling great. And I also apparently need to sign my kids up for CPR training. So I'm learning a lot, learning a lot.
Yeah, no, I uh, truthfully and basic first aid. Strongly encourage that. I wish I personally, it's an apolitical statement, I think, but I'd like to see that taught in the public schools.
Cool. Yeah.
It doesn't seem controversial to me. It's so critical. It's critical
Mhm.
for our society at large. It's also a way to introduce your children to concepts of healthcare and to feeling empowered in their healthcare and their ability to care for others. It's also potentially a citizenship thing for your
Yeah.
kids. So by you encouraging your children to learn those basic things, learn symptoms of stroke, learn those basic things, you're implying to your children that it's not just their care or their care of their family, but it's their care of their community is um, it they can participate in that and they have a role in that. And so I personally feel very strongly about that.
Well, Dr. Sampson, we've taken a lot of your time today. We
Yeah.
really appreciate your expertise. Is there anything else that you wanted to add that we didn't touch on that you really feel is important to get the message out?
No, I think we covered all the bases. Again, I would emphasize the importance of primary care and primary care providers, and that here at Guthrie, we have specialists in multiple fields that can back up your primary care providers and are a resource for them. And we're at their fingertips, so to speak, so that you can get comprehensive care here uh, through Guthrie. Thank
Great.
you.
Great. Thank you very much for
Great.
joining us today.
Yeah, thank you both.
Well, thank you to Dr. Sampson, and thank you to our listeners for joining us today. Certainly a lot of learnings for us all to take home. We are approaching, Steve, Thanksgiving. It's right around the corner, probably making our travel plans or planning when we'll have to start thawing our turkey. And along with that, when you're eyeballing that table full of turkey and all those delicious sides and knowing that there's pies just around the corner, remember that many Americans are fast eaters. We have this habit of eating meals as quickly as we can. And if you don't take the time to thoroughly chew and savor that food, you're going to eat too fast. And that's when we all end up on the couch with our stretchy pants watching football. So take your time and give your brain that 20 to 30 minutes it needs to tell you that you're full.
I am definitely guilty of this 100%. And then I sit there and I regret it every time.
Oh,
And
yeah.
so why not just enjoy the game? So, like you said, go a little slower. You'll still get
Hmm.
there for the game. I know I will. And then
Yep.
later on, since you'll realize you're full, then you can wait until later and then maybe have another slice of pie later on. Maybe that's
Yeah.
a good idea.
Round two, right? That's what everyone's ready for on Thanksgiving.
Awesome. Well, happy Thanksgiving to you, Dr. Johnston, and to all of our
Thank
listeners and
you.
viewers. If anybody would like additional information or wants to listen to previous episodes, you can always go to guthrie.org/engage because Guthrie
Mhm.
Engage, it's our platform to really let people know different tips about not just today's topic, but a little bit of everything to help you with your daily lives. So that's guthrie.org/engage. And if there are any school programs who want to put together their own version of Head, Shoulders, Knees, and Toes, we want to remind you that you can send in your recorded clip to corporate_communications@guthrie.org. That's corporate_communications@guthrie.org. We can't wait to hear from you. But until then, have a great holiday.